So a common question I get from patients is, do I need an MRI? So oftentimes we'll have a patient go to a doctor. Doctor maybe might send them to a specialist. Specialist decides, all right, let's go ahead and do physical therapy, or sometimes they get an MRI. But let's say in this example that the patient comes without getting an MRI from their primary care physician. They're having pain, oftentimes it's spine pain, low back pain. That's where I usually get it more, where I hear that question a lot more times. And the answer to that question of do you need an MRI is no. And the reason why I say that is because MRIs don't show pain. Pain is subjective. It's within your brain and how you interpret it, right? It's not something you could put on an image. Now, so we were just talking about pain. So if you had issues that are more severe other than just pain, usually going to be numbness and tingling, severe weakness in the extremity, and you have back pain maybe, that's when you need an MRI, because an MRI can give you ideas about structurally what's going on that might be causing the massive numbness, tingling, the sudden drop foot. All of a sudden you can't hold cups because your hands are so weak. That's where the MRI is important. But if you're just talking about someone who just has pain only, right, the MRI actually might not be as beneficial as you might think. The reason I say that is because I feel patients are very visual. They need to see a picture to be able to explain how things are, and using that image can hopefully help put them at ease, right? But oftentimes the MRI will come negative. So those patients who do see a specialist and then they do get an MRI, I'd say about 90% of the times that I get an MRI, the MRI is going to show something. It's going to say they have a 2 millimeter disc bulge, some type of osteophyte formation, some forms of arthritis, right? But that's about 90% of the time, the MRI actually doesn't really explain why they're having pain, right? So hopefully if all goes well, they have physical therapy, they have treatment, they actually get better, right? But if there's some form of arthritic changes or disc herniations, I guarantee you that I didn't make any changes with them. That patient didn't make any changes that we're using the exercises or manual therapy techniques that we use. So therefore, if you still have arthritis and still have a disc bulge, was that really the responsible reason why you had pain? All right. So if you feel like maybe you need an MRI to explain things, in reality, to tell you the truth, more often than not, it doesn't really explain anything. So you're better off going and getting treatment at least to be able to mitigate your pain, or at least get you to be able to function back into life. So if you have any questions about that whole MRI thing, or if you really do feel like that maybe an MRI would help and would need in contact with a specialist of some sort, feel free to go ahead and contact us. We have a large network of other physicians that we do refer to. We can always give you a name depending on where you live, or you can always contact us for any other questions. Thanks.